Hello, my name is DianaAmpievett, and this is my capstone project for Spring 2017 VETT215. This is our certificate that we are approved, OCCI approved facility of Banfield, and this is my ID. Here. So I'm going to get a lateral on our radius ulna. I have measured already. Using the calipers, I measured the distal end of the humerus, came up to 3 centimeters. Our chart told us that we have to be at 100 MA over 1 over 60 seconds. Our MAS is 1.7. Our KVP is 63. So we're going to go ahead and start. Want to do that first? Hi, my name is Diana, and I'll be doing radiographs on the stifle today, on the right stifle. So we're going to go ahead and use our calipers and use and measure above the stifle of distal femur. I got about 3 centimeters, so I'm going to go out on my technique chart and do 100 MA, 1 over 60 seconds. 1.7 MAS, and then 62 KVP. Alright, 63 is the closest. Alright, so we're going to go ahead and lay our patient on his right side. So come over. Lay our patient on his right side down. And his lower leg. Pick it up. Okay. There we go. Okay. I'm going to go up to label 1. Our borders are going to be the middle shaft of the femur and then the tibia fibula shaft as well. In the middle will be the stifle. We're going to kind of do a running man and leave the stifle, try and be its normal position. Okay, today we're going to be doing thoracic radiographs on our patients. We're going to be showing you the lateral. So first we're going to go ahead and measure our patient. We're going to put her on the table. Hey, baby. Left side. Okay, 1, 2, 3. And then we're going to measuring collar to the scapula. There. Getting about 16. Sorry. 16, so it's 300. Yeah. Then using our charts. Setting the right, putting the right settings in. 76. Okay, so now we are going to turn off the light. Going to be doing her left lateral first. Put our marker down. Set this up. Okay, so we are going to get in the field of view. We are going to try and get from the cauda of the scapula to the last rib, first lumbar vertebrae, and then pointing the central beam at the here at the strongest part of the heartbeat. It's the central, like the ribs, central. I'm going to try and collimate as small as possible. We're going to extend her front legs and extend her head to make sure that everything's pretty straight. Okay. We'll try to get it at the peak of inspiration. You're okay, baby.
You need that on.
Huh?
No, you can see it.
Alright, today we're going to go ahead and do x-rays on the abdomen. We're going to go ahead and measure our patient on the thickest portion, which is about the 7th, 8th rib. We're going to go ahead and do that really quick. Alright, so we have 21 centimeters. So we're going to go ahead and go to our technique chart and put in the correct case. Alright, so we're going to go ahead and try and collimate as much as possible. That is the widest that it goes. So I'm going to try and get the first portion. And then I'm going to try and get her at expiration. This is her left side. Down. Alright, so we're going to go ahead and try and collimate as much as possible. That is the widest that it goes. So I'm going to try and get the first portion. And then I'm going to try and get her at expiration. This is her left side. Down. All right. Alright, I'm going to do the lateral aspect. Try again to get her at her expiration. Oh, no, you're missing. Try again. I'm sorry, baby girl. Okay. She's not fun. Ready? My God, I'm just exposing us to
It's ready now.
Okay. Alright, now we can extend that.
You were recording all of that, right?
Yeah. Why are you ending? Hi, my name is Diana, and I will be doing radiographs on our thoracic spine. I will be measuring our patient. We'll be measuring at the thickest area, which is by the shoulder joint. So I get 12 centimeters. So with our technique charts for extremities, for spine, we're going to do 300 MA. One over 60, 5 MAS, and then 75, which that's the closest. Right, so we're going to put our patient in dorsal recumbency. Oh boy.
Oh boy, now. Here, I got that. Stop. Okay, just place it on there. Yeah.
I'm going to place our marker to the right side. And then okay, so today we are going to do some hip radiographs. We're going to measure the thickest part of the pelvis. Here, our patient is coming out of surgery for her dental cleaning. So I'm going to try to do this pretty quick. Alright, we are at 15. We already have a chart made. Our chart here for 15, it says 300 MA. 1 over 60 seconds. Okay. 5 MAS and then 81 for kbp. Alright, 81 for kbp. So everything is all set up. We're going to do her ventral dorsal view. So we're going to use a trough here. Okay, so for the VD, we are have our patient on the trough. We are going to line her up. The my borders are the wings of the ilium, and then I need to go as far back to the distal patellas. Try and do that. She is a big dog, so we're going to try our best here. We need to push her forward a little bit. It's tough. Like, oh, push her forward. Yeah, push her. I guess put her head. All right. And then I'm going to put on my gloves, my third leg gloves. Oh, sorry, my leg gloves here. And then we are going to left lateral here. Label it. Alright. Make sure she's straight as possible. Looks very straight. Good. Okay, today we'll be taking some dental reds on our patient. I have our cassette here, number 4, and we're going to be doing the right maxilla. So I'm going to go ahead and place my cassette. And I'm going to line up the machine.
What would she cost it? Honey. I can figure out. Yeah. She's probably got it all.
No, she's got
It's about 6 inches away. Okay, now we're gonna come and label our radiographs. It's gonna be the right maxilla. And we're going to go ahead and take our picture. Okay, we're gonna go ahead and radiograph the right mandible, the right side. So I'm gonna go ahead and use my cassette, number 4. And we have our dot out. We're having a harder time placing this one. We're gonna line up our machine. And then we're going to label appropriately. We're gonna do the right mandible. Probably won't get the back molars. Let's see. Right. I'm gonna go ahead and take our radiograph. Today I'll be doing my radiographs on a stuffed animal for the contrast GI study. I have my stuffed animal right here. My calipers, I'm going to go ahead and measure. Okay, so it's about a 1 centimeter on that. So I'm going to take my lateral first before I do any of the barium administration. I'm going to go on my KBP chart. It's going to be 300 MA, 1/120 seconds, 2.5 MAS, and then 58. Right, so this technique is just like a normal lateral abdomen. I'm going to label my side. We're on our left side down. I'm going to extend the front limbs cranially and then the back limbs caudally. I'm going to try and get from the apex of the heart all the way to the coxmoral joints. A little bit harder, stuffed animal. Alright, now we are ready to start our barium administration. So I have my tube, I have my roll of tape, my syringe, my surgical lube, Sharpie, and my barium. Alright, so I'm going to go ahead and first measure the tube that's going to go down the esophagus. So it's going to be from the mouth all the way to the last rib. I'm going to go ahead and Sharpie that, make sure that I know that's where I need to stop. Alright, so then I'm going to go ahead and, this is my mouth gag, place it in on the dog's mouth, and then close this out. I'm going to go ahead and lube up the tube. Okay. And I'm going to go ahead and start passing it. Up to the stop points where I had already pre-labeled. Okay, and now I am going to take some barium and administer it through the tube. The way that you know that the tube is passing through the esophagus and not the trachea is by palpating the ventral side, and then if you can feel the trachea and the tube and that means you are in the esophagus. Slowly draining in. Alright, so right after the barium administration, you go ahead and you take a radiograph. Right, now that we have administered our barium, I'm going to go ahead and take my lateral and VD of our stuffed animal. This is immediately following the barium series. Then you're going to do it 30 minutes after, 60 minutes after, 90 minutes after, 3 hours after, 5 hours after, and essentially the day after. So you just make sure that all the barium has passed through. So I'm going to go ahead and left side. Our machine has already been set to the appropriate numbers because it's the same patient. So I'm going to go ahead and do Alright, so we're going to do another lateral abdomen and a VD. We're going to head from the borders are from the apex of the heart all the way to the coxfemoral joints. Essentially in this about there.